Hi, in this video we will be discussing about carbapenems. These are a group of powerful beta-lactam antibiotics. I call it powerful because it has got the widest antimicrobial spectrum of all available antimicrobials. So they are effective against a wide range of gram-positive and gram-negative aerobic and anaerobic organisms, including those that produce beta-lactamases and extended-spectrum beta-lactamases. However, they are inactive against MRSA and Enterococcus faecium. Carbapenems are usually reserved for treatment of serious infections or mixed aerobic and anaerobic infections or infections caused by multi-drug resistant organisms. As carbapenems are beta-lactam antibiotics, they have a beta-lactam ring in their structure. And their mechanism of action is also similar to penicillins and other beta-lactam antibiotics. That is, it binds to the penicillin-binding proteins, thus prevents transpeptidation. Hence, this inhibits the cross-linking of peptidoglycan layers and hence inhibits bacterial cell wall synthesis. Now let's look at the drugs that come under this class. The first one is imipenem. An important point to note here is that imipenem is rapidly inactivated by renal dehydropeptidase. This means that if imipenem is given on its own, it would be metabolized too quickly to be effective. To overcome this, it is combined with cilastatin, a dehydropeptidase inhibitor, which blocks its breakdown by the kidney. Other carbapenems are resistant to renal dehydropeptidase degradation and hence do not require cilastatin. The other drugs that come under this class are meropenem, ertapenem, and doripenem. Moving on to pharmacokinetics, they are administered intravenously. They are widely distributed to body tissues and fluids, including CSF, except ertapenem. They are eliminated by renal tubular secretion, and hence dose adjustments are required when given to patients with renal impairment. Here are some of the potential adverse effects associated with carbapenems. So we have cross-sensitivity reactions. Patients who are allergic to penicillins may also be allergic to carbapenems, and the incidence of cross-reactivity is usually less than 1%. There may be gastric disturbances such as nausea, vomiting. It can also cause seizures in patients with epilepsy. Imipenem is more likely to cause seizure than other carbapenems. And lastly, it can also cause blood disorders such as anemia, leukopenia, thrombocytopenia, and altered bleeding time. That's it for this video. Thank you so much for watching.